We're very fortunate in ABM that we've got a really enthusiastic chief executive in Paul Roberts, and he led by example. He included Champions for Health in his weekly blog, in his staff team brief that's cascaded face to face throughout the organisation. He's developed an idea of an interdirectorate challenge KEP. So really, I think that was the main thing, was the chief executive, being enthusiastic about it. I then sent a message out through, I've got a staff health and wellbeing brief that I write that goes out once a month, and I just constantly reminded staff about Champions for Health and to sign up, and also gave an update on the numbers. And I think we got to 272 by the end of the period for signing up. Some of the sort of challenges we faced were that people were worried that somehow the organisation was checking up on them, how much they ate, how much they drank, how little exercise they did, and it was just sort of addressing some of those worries and being able to reassure people. But in the communication that I was sending out as key contact, I did have some really lovely stories from people, who were making progress and who were very happy to share their stories on the Champions for Health website, which was brilliant. I think one of my key learning points has been that we went with a Christmas communications campaign, and with hindsight, I think that should have been a New Year campaign. People were very tired with within NHS Wales coming up to Christmas. It's been a tough year. I know certainly from my point of view, I've stuck to a diet for a year and I wanted a fortnight off, and I had a fortnight off, but I'm geared up now in the new year to start again. So I think with hindsight, it would have been good to have a New Year campaign, although I'm sure the Christmas campaign did help people. I think success would look like, obviously, more people in work and more productive in work. But, it's some of the intangible benefits of, the feel of the organisation, the culture of the organisation, more engaged staff, staff developing services for themselves and for the public, but making ABM an employer of choice, really, that people want to work for ABM because it's an organisation that looks after its staff, and therefore staff look after the patients better as well.